you're free. No one could have witnessed what you did to me, 'cause you wouldn't know me today. And you have got to see to believe. From the fading light of light, rise like a phoenix out of the ashes, seeking rather than vengeance, retribution. You were won. Once I'm transformed, once I'm reborn, I rise up to the sky. You threw me down, but I'm gonna fly. Rise like a phoenix out of the ashes, seeking rather than vengeance, retribution. You were won. Once I'm transformed, once I'm reborn, you know I will rise like a phoenix, but you're my
Rise like a phoenix. Some of us might remember this torch song of Conchita, which made him become the winner of the European Song Contest several years ago. Why did he win with this song? Probably because it expresses so beautifully the urge in all of us to leave the old normal behind, elevate it to a new quality and new normal in life. Rise like a phoenix, let the old behind, reach the highest of a new normal. In Conchita's case, it is that the new normal is the expectance, the personal expectation and the acceptance of LGBT rights in our society, something which is all very important for us. But in the case of the European Health Forum Gastein, rise like a phoenix means leave the old health politics behind, level them up to a new era of multilateralism. And I think this is the single most important message from this European Health Forum we can convey to all of you. You may ask, why has multilateralism in health politics rise like a phoenix? I will try to answer this. Remember a paradoxon. If Donald Trump would have won the last US presidential election, which was not so unthinkable of, so yet the United States of America would have left by now the WHO, the World Health Organization, by July 1st this year. Can you imagine a WHO without the US, the biggest single donor, the stronghold when it comes to innovation in public health or in science? But the paradoxon is the following. Not that the US was so close to abandon the World Health Organization. No. WHO did underperform, not deliver to expectations during this pandemic crisis, too underfinanced, too understaffed, weakened internally, and an old-fashioned governance structure. A few of the analytical critical points in this context we all have to make. You know, I personally was until March one of the Austrian national coordinators when it came to COVID-19. And simultaneously, I was a member of the executive board. But these two functions never communicated with each other. The executive board member, Clemens Sauer, never talked to the national coordinator and vice versa, because they didn't have a connection to each other, because the executive board never was asked to intervene in this critical phase of the pandemic crisis. So you see what I mean here. You may say, forget multilateralism and on the level of policy making. All politics is local or regional, especially also in a pandemic crisis. Yes, this is true when it comes to tracking and tracing infections, organizing test centers or test sites to control the development of new cases, to start and organize the uptake of vaccination programs. But this is not true anymore when it comes to cross-border and international travel restrictions because of pandemic spread of a virus. And think about all the restrictions we had to suffer through in the last 20 months. It is not true when it comes to research and development or manufacturing vaccines or therapeutics. And it's not true when it comes to equal access in distributing such new technologies and vaccines, for example. And this is not only a question for Europe, for the European Union, but a much more important question if you look at it in a global perspective. Of course, we have seen also good examples of international cooperation during this pandemic crisis. Especially the European Union made a quantum leap in the direction of a European health union. Since we have Sandra Gallina among us, the both of us, we were chairing a highly successful joint procurement process of the 27 EU member states for the COVID-19 vaccines. A true success story, you might say. Unthinkable that the 27 member states would have made that all by themselves. The most important point here is we all had equal access to the same technologies, to the same time. There was no first come, first served. So this is a good example of international cooperation. There you have an example how we should take up lessons learned, not to do more of the same and find a new way of a European health union. For example, joint procurement initiatives when it comes to innovation and technology. Friends, we have debated that in European Health Forum many, many times. There is no equal access of innovation and technology innovations within the European Union. Or another example, organize shared preparedness to the future pandemic crises or secure European supply chains. So there is a lot to do when it comes to organize and form this European Health Union. And we have several sessions on Wednesday, the second plenary session, and also a special session on HERA, because these are the examples we have to pick up from this. But this last success story of the European Union has a second phase, not a such pretty one. No real mechanisms are in place when it comes to sharing the surpluses of doses which are already bunkered somewhere in the warehouses of the European Union or which still will come to the countries of the European Union under contract. We don't have these multilateral international mechanisms to share these things. So there is much room, rise like a phoenix, for improvement along the way for a European health union. Let's have a global look. The big leaders in the European Union and elsewhere around the world woke up and started to urge for a new binding legal instrument for better preparedness and response in a pandemic situation. It is a call for a pandemic treaty, legally binding for governments, for the intergovernmental relations, and for the different competent authorities around the world to have a regime of sharing information and political decision-making. In this European Health Forum, Gastein, we have to ask the critical questions. What is the added value of such a pandemic treaty? Is information sharing just a one-way street? Is it only about sharing information, data about, for example, the genomic information about the virus? Or is it also about sharing technologies which are developed from this shared information? And when it is about sharing new technologies, equal access to these technologies, for example, equal access to vaccines, then we have to ask the critical questions, is it not about intellectual property waivers, shared licensing of technology? This list is very long, which has to be tackled in a true pandemic treaty, which has an added value for all the people around the world. So rise like a phoenix, I would say, old Europe. And I want to call upon us, leave behind the usual normal. the usual reflexes when it comes to protect the geopolitical superiority in the case of innovation and technology. Are we ready to overcome these hurdles, the barriers for global equity and access to technologies? This year's European Health Forum Gastein wants to ask all these questions. Thanks to Hans Kluge, we have a report from the Pan-European Commission on the table, which is showing one very important message also. It is not only about health. If we want to overcome inequalities in health, it is about constituting a new social contract. I'm really looking forward to the session on Friday, and we can discuss this with the chair of this Pan-European Commission, with Mario Monti. So let me conclude. Welcome to this European Health Forum Gastein. In the name of the board, of the advisory committee, of Dorlik K. Gottlieb and her wonderful team, we tried hard to make it happen, and I hope we can inspire you to rise like a phoenix beyond the old normal. Again, coming back to the normal is not an option. This, please, take it home. And this is the most important message we can give you from the European Health Forum. On this occasion, I also would like to introduce the moderator of this plenary session, Suri Moon. She is the director of the Global Institute in Geneva, and I thank Suri that you take on this challenge to guide us through this plenary session. And now I also would like to announce that the Minister of Health of the Republic of Austria, Wolfgang Mückstein, sends us his welcoming remarks. But most important, enjoy this week with us, with the European Health Forum. Thank you very much.
Good afternoon, honored guests and friends. It is my pleasure to welcome you to the 24th European Health Forum Gastein, taking place digitally for the second time. Unfortunately, due to the current COVID-19 crisis, we are not able to meet personally in beautiful Bad Hofgastein this year. As ever, the European Health Forum Gastein team has been working around the clock with international program partners to produce an interesting, inspiring and interactive week for all of us. This year, the European Health Forum focuses on 4 key topics: complex systems, transforming tomorrow, joining forces for health, and leveling up together. These areas offers a number of central lessons that we in the European health community must consider and take forward. For one, we have to recognize that we are dealing with complex and interconnected systems. Plus, our health systems are still recovering from shocks and the crisis mode of the last 2 years. A way forward in these extraordinary situations is to try and simplify complex systems and focus policies around one health. The pandemic has also shown how fragile our social structures in general and our healthcare system in particular are. We can only be resilient, efficient and effective in our response when joining forces and working together. The often repeated mantra that nobody is safe until everybody is safe has never been more relevant. Therefore, I'm happy that the question of how we can better cooperate in the face of future crises and the role that Europe can play in the future is the focus of today's plenary. As we strive for a new and better normal for everyone, solidarity, mutual support and equity are key principles for our strategies. And finally, also, we are still in the midst of dealing with the pandemic. We also have to address new challenges on the horizon. This pandemic has shown that we have the ability to quickly adapt and innovate when time is of the essence. Let's seize this momentum and continue to develop the transformative changes we need for a better tomorrow. And as we move forward, we need to address the gaps and unmet needs that have become so apparent during the pandemic. When health is at the heart of the recovery process, Europe can rise like a phoenix from this crisis, stronger and smarter. I wish you all a very productive and enjoyable conference and hope to see you next year in person at the European Health Forum Gastein.
Thank you so much. My name is Suri Moon. I wanted to thank the European Health Forum Gastein for the invitation and the great honor to be here with all of you moderating this plenary session. As you heard from your president, the topic of this plenary session is multilateralism. And throughout the next few days, a number of the key topics that we'll be touching on in more depth will be explored in detail. But today we're really here to talk about multilateralism writ large. And of course, we need no reminder that multilateralism really collapsed under the weight of a virus about 20 months ago. And so what we're here to explore today is the question of how we can, in fact, strengthen, reinvent, rethink multilateralism for the challenges coming in the future. What I'd like to do is to give you a quick overview of how we'll be spending our next roughly hour and a half together. The rest of this session is organized in 3 parts. We'll begin with 3 spotlight speeches, and our spotlight speakers are really here to challenge, to help us to think critically, and in some ways to provoke our panelists, who will be our second set of speakers. I'll introduce each of them in turn. And then after our panelists have responded, we'll also be going to our audience. In fact, we'll go to our audience very, very quickly and try to keep this session as interactive as possible and ask for your inputs. I'll tell you how in just a second. And then we'll wrap up with my predecessor here at the Global Health Center, Professor Lona Kickbush, who will be helping us to make sense of the wide ground that we're going to be covering by pulling all the threads together at the end of our session. What I wanted to do was to flag that we will have a poll very shortly. We also encourage all of you to encourage in these discussions via Twitter by using the hashtag pound EHFG2021, EHFG2021. We'll also be turning to Yanis Natsis from the European Public Health Alliance, who is staffing our newsroom, who will be keeping an eye on Twitter and also on Slido, where you can post any questions or comments that you have for our panel members. So please do participate either on Twitter or on Slido. For Slido, you can go to app.slido.com and put in the keyword EHFGP1 to participate directly in our discussions. Last but not least, we'll have a cartoonist who is capturing in visual terms the discussion, Floris Uthorn, and we will be turning to him and checking out his work from time to time throughout the session. So as you can see, we have a really action-packed agenda. We have a very interactive agenda with many different perspectives, which is really, I think, essential to explore one of the most important and consequential questions of the day, which is indeed, can we save multilateralism for the future? Given how it's been made much more fragile and its weaknesses deeply exposed by the current crisis. So without further ado, let's turn to our first spotlight speaker, who is the Director General of the World Health Organization, Dr. Tedros, who has provided us with a video intervention.
Excellencies, dear colleagues and friends, the effects of the COVID-19 pandemic have gone far beyond the suffering caused by the virus itself. The social, economic, and political consequences will be felt for years to come. Even some of the richest and most powerful countries with the strongest health systems have been overwhelmed, including in Europe. The pandemic has also shown that we can only confront a common threat with a common response. That's true for our efforts to bring the pandemic under control by vaccinating 70% of the population of all countries by the middle of next year. But it's also true for the steps we must take to build a safer world. We need better governance that's inclusive, equitable, and accountable, including a legally binding international agreement on pandemic preparedness and response. We need better financing for national and global capacities using existing financial institutions. We need better systems and tools to detect, prevent, prepare for, and respond rapidly to outbreaks. And we need a stronger, sustainably financed, and empowered WHO at the center of the global health architecture. We very much appreciate the strong support of the EU and its member states for multilateralism, global health, and WHO. And that support is more important now than ever. The COVID-19 pandemic is a powerful demonstration that when health is at risk, everything is at risk. And that resilient health systems built on strong primary health care are the foundation of resilient societies and a resilient future in Europe and around the world. I thank you.
Extremely busy schedule to share these reflections with us as we begin our discussion. Indeed, a very, very ambitious agenda for how to strengthen the global system for pandemic preparedness and response. And one of the big questions is, of course, can we do so? I'm really delighted now to introduce our second spotlight speaker, Elena Lazaro, who leads the External Policies Unit of the European Parliamentary Research Service, to share some of her reflections and indeed to challenge our panel members to think about what indeed will be necessary to strengthen what we're referring to as multilateralism today. Over to you.
It's a pleasure to join everyone virtually at the European Health Forum Gastein, and a big thank you to the organizers for including me in this panel and to you for chairing it. And now, before I start, perhaps I should admit that being on this panel for me is a challenge. In my country, Greece, we have an expression about feeling like a fly in milk, which essentially means when you feel that you are not really part of or supposed to be somewhere. And this is very true of me in a way, in the sense that I have never worked on health. But I have worked on multilateralism and international relations. And I think the mere fact that today discussing multilateralism is part of the conversation about health shows us the degree of interconnectedness between transborder threats, between policy areas, and the necessity for collective action on the political level, in areas of economics and development, in health policy. And all of this has been manifested by the pandemic crisis. Now, today I would like to share 3 thoughts about multilateralism and the ways in which our thinking about it has been affected by the pandemic. The first group of thoughts has to do with the ways in which COVID changed our thinking about multilateralism, but also what it illustrated about the current multilateral arrangements in the world. The second has to do with what I think is the crisis that multilateralism was already undergoing. And there I will argue that I don't think it's COVID that has brought about a crisis in multilateralism, but rather has manifested and brought to the front trends that already existed and the already existing need to reform multilateralism to adapt to today's age. And the third set of provocations or thoughts has to do with the argument that Europe and the European Union are best placed to lead the reform, the adaptation of multilateralism. And there I want to say it is interesting that the theme of this conference is Rise Like a Phoenix. In the work we've done at the European Parliament's Research Service, we've referred to the way forward on multilateralism as a Darwinian moment, in the sense that multilateral institutions need to adapt in order to evolve and survive. And Rise Like a Phoenix, the idea of rebirth, is very similar to that. Now, as I said, I wanted to start briefly by suggesting that that COVID and the pandemic and the response required for the pandemic brought to the fore essential issues which needed to be addressed with regard to current multilateral structures. And I'll make a very small parenthesis here to just mention that by and large in the literature about multilateralism and for those who study multilateralism, multilateralism generally refers to a modality of cooperation among 3 or more states, but the number is not that important, although we do talk about collective multilateral institutions, so those that include by and large all states recognized by the UN, but multilateralism can also be cooperation between more limited numbers of states. But I think what's more important about multilateralism, the way we perceive it in international relations, is its principles. So multilateralism generally refers to cooperation which is based on a set of generally agreed upon rules, generalized principles of conduct, and it comes with 3 principles. The principle of indivisibility, so everyone participates, non-discrimination, so there is no most favored nation, but also most importantly, the principle of diffuse reciprocity, which means that by and large it's agreed that the outcome across time of multilateral cooperation will bear equal benefits for all of the partakers, for all the parts of the multilateral cooperation. I think this is important to keep in mind because that was the idea to begin with. And in many ways, it's the failure of multilateral institutions to keep to these principles and multilateral cooperation that has brought some disenchantment with multilateral cooperation about. Now, going back to COVID, as has been said by the previous speakers, the pandemic hit the world globally at a moment where multilateral cooperation was facing a crisis, where multilateralism was facing a crisis, and it brought to the fore the basic weaknesses of the multilateral system. On the one hand, the inability of decision-making processes to produce a direct and immediate response, blocked by geopolitics and power dynamics, showed the world that indeed there was a blockage in the way to address a crisis which by and large was global, needed a global solution. It was cross-border. It needed cooperation across north, south, east, west. And at the same time, while all of this was happening, an administration was in place in arguably the global leader, which is the United States, which, as was mentioned, almost led to the withdrawal of the United States from the World Health Organization, the most relevant multilateral institution to face this crisis. So really, in many ways, there was a crisis coming, a crisis of multilateralism that has been discussed by scholars for about over 10 years now. And what it was waiting for was the explosive moment that a global trans-border challenge and security threat would hit the world, and that would test the multilateral system. And in many ways, that was the pandemic. It really came to test the resilience again, reminding me of this Phoenix example. And in that test, all the weaknesses of the existing multilateral system, multilateral institutions that had been discussed for years, just came to the fore. A big moment where it was realized that no, the world as it is, with the existing network of multilateral institutions in place, without reform, is not ready to cope with such a big trans-border global threat. So this crisis consists of more or less 4 or 5 big issues. As I said, the first is the nature of current geopolitics, the return of great power rivalry, which has led major players, big powers, to use multilateral fora in several instances as fora for competitions, for blockages, and that decision-making structure is perhaps the first issue that needs to be addressed. The second, and it has been alluded to, I would argue, is the widening gap between public opinion and global governance, or the structures or multilateral institutions. I refer to global governance as a big network of multilateral institutions. throughout the years, and specifically in the context of the global financial crisis, it's over 10 years ago, or more or less 10 years ago now, suspicion and mistrust from the public with regard to what was referred to before as the social contract by Clement Sauer. So the ability of global institutions to deliver public goods to the average person. That distrust, that suspicion has created this disconnect of people, and therefore leading to challenges of the legitimacy of multilateral institutions and their ability to deliver. So low public support. That to that we could add the trend of return of nationalisms, ethno-nationalisms, various types of currents and moves that are against globalization. So that in itself leads to the challenging of the raison d'être of multilateral institutions. And fourthly, I would say beyond this disillusionment is also the inability or the lack of progress in multilateral institutions themselves, from the UN to the WTO, to adapt, to modernize, to include solutions and ways to find solutions to new problems, new agendas, mostly those that have come about as a result of technological advantage, scientific advances, but also new threats emanating from the environment. So in many ways, the threats challenging humanity have evolved faster than the institutions that have been created multilaterally to cope with them. And that is also in many ways a problem of political consensus. So in the face of these crises, of these challenges, of course, COVID comes, the need for a pandemic response appears, with demanding immediate responses on the global level to tackle both the health consequences, but also the economic consequences, social consequences. And that is where the system is tested. And it's no coincidence that in this moment, the European Union, which perceives itself and which can in many ways be a leader in the reform of multilateralism, not least because it is itself a multilateral organization, produces its strategy to reform multilateralism, a communication that was produced by the Commission earlier this year. And indeed, I would say that it does identify tools, but also a vision for how multilateralism should look in the future, how to face these problems. And indeed, it sets out a basic need identified by academics, but also parts shared by many of the democracies around the world for a multilateral system that is more participatory, that is more inclusive, that is more multi-stakeholder, bringing in not only states, but also other actors in society that nowadays are critical to the solution of problems, ranging from business to scientists and other and civil society stakeholders. The multilateralism of the future, as appears not only in the EU's approach to rebuilding it, to reforming it, but also in most relevant studies, is also one that is a mix, a hybrid of collective multilateral institutions, but also places a lot of importance on regional organizations, on cooperation within minilateral structures of states. So really a system of collaboration and cooperation under a bigger umbrella of agreed upon principles and values, but also the multilateralism of the future. And this, I think COVID has shown us more than anything else, is one where we cannot see silos between the different areas of policy which are dealt with by different multilateral organizations. And in that sense, I think the pandemic has been more eye-opening than anything else, because the need for a response to the pandemic has gone through the mandate of what the World Health Organization is responsible for. But there we've seen trade aspects, we've seen intellectual property rights aspects, and other initiatives that go under the WTO umbrella. We've seen the security dimension of it, which goes under the UN umbrella. And we've seen the need to create sort of ad hoc new initiatives like COVAX, with the support of businesses and science to face problems. So the multilateralism of the future, if it is to face transborder global problems of such a nature as a pandemic, or I would add a climate-related global needs to be agile. It needs to bring about political consensus. It needs to be able to create policies that can be implemented, and it needs to bring together a number of policies to counter one specific problem. So I leave my first 5 minutes with these thoughts among the many that I had scribbled down, but just to say that the way I think we should see it is not that multilateralism collapsed, as was said before by one of the previous speakers, but rather that multilateralism met the moment which will force it to make adaptations and changes that need to be made in order for the world to be able to face problems of the future. Thank you.
Thank you so much, Elena, for that very succinct overview, and also for the reminder that multilateralism is not just about international cooperation, but also about rule of law and certain key principles. What I'd like to do is turn now to our third and final spotlight speaker, Dr. Els Terele, who is a visiting fellow at the Institute for Innovation and Public Purpose at the University College London, who will be sharing some reflections for the panel members on the role of the European Union in spearheading common goods for health. Els, over to you.
Thank you so much, Suri, and thank you so much to the organizers for allowing me to share just a few reflections indeed in the 5 minutes that I've been allocated. Food for thought. So I want to make 4 points. The first is being asked to talk about how the EU can spearhead common goods for health. I think it's important to talk a little bit about the term common goods. I looked up the WHO definition, and it actually focuses on policies, interventions, and functions of government that require collective financing and that are actually the subject of market failure. So meaning that they cannot be delivered or financed through market forces. And what is very interesting is to see that goods, although we say common goods, actually do not apply, according to this definition, to the goods that we've all been talking about a lot in this pandemic, which are the medical countermeasures, the health technologies, be it the PPEs, the protective equipment, oxygen, diagnostics, essential medicines, vaccines. All of those are, according to the classic definition, not really considered as common goods. And I think that this is a realization that we all share in this pandemic, that maybe there is a need to rethink that fundamentally. In fact, what we see is that these goods and actually the knowledge, technologies, know-how underlying the goods are not at all considered common goods, but are considered commercial assets. And that has created a lot of the problems that we have witnessed so far. And so to come back to what Clemens said, we need to leave the old health politics behind. I think that certainly relates to rethinking what common goods actually are, and to consider these critical health technologies indeed common goods. A second reflection is on indeed the nature of multilateralism, to say that we need to think about what is the relevant unit for multilateralism in the context of a global health crisis. And I want to remind ourselves that we consider now the pandemic a global health crisis, but let's not forget that we are in a chronic crisis of the lack of global health equity before the pandemic even, and actually the pandemic has only exacerbated those already existing health inequities, and that are of course a function of the underlying economic inequities. And so if we think about what is the best unit for multilateralism, the first question is, for what purpose? So if the purpose is indeed global health, then we have the second question. It depends multilateralism for whom, and we've heard already that the EU has been quite successful in building this vaccine purchasing, this shared vaccine purchasing, and allowing that within Europe everybody had equal access at the same time, more or less, to the health technologies. But we also know that that was only valid within the EU, and that towards the rest of the world, Europe has been acting and is being perceived as protectionistic, nationalistic in terms of Europe, for instance, in its response to the demands about the intellectual property waiver, and actually thinking about global vaccine action more as an issue of aid rather than of justice or real multilateralism. And I think we have de facto also now a multi-stakeholderism that has replaced the classic multilateral forums. And it's not necessarily because that has been chosen, it has been the powers that be, namely the power of the private sector and a number of philanthropies that have become de facto an element of the current governance structures. And with all the questions that also Elena referred to about legitimacy, inclusion, and representation. And we have seen that in all the criticism that has been articulated vis-à-vis the ACT Accelerator, COVAX, where basically the instruments that were supposed to provide and accelerate access to health technologies for the rest of the world were governed in a way that the rest of the world was not really represented. Then I come to my third point, and I'm going to speed up a little bit because I think I may run out of time, is that we need to think about the framing of our multilateralism, and in particular vis-à-vis health. Are we actually thinking about governing global health as health security, or are we actually thinking about public health? And I think those are two very different framings. For instance, if we think about public health, then we consider that we have a collective problem for which we need to find collective solutions within the unit of multilateralism that we are thinking about. And the pandemic has shown us that this needs to be at a global scale. And so collective solutions means data sharing, knowledge sharing, technology sharing, and of course, the ultimate goal of having equitable access globally. However, if we look at the health security frame, it's very easy to see immediately that it induces a much more isolationist approach, much more nationalism within the units that we care about. Self-interest, in the best case, enlightened self-interest, if we think about the rest of the world. And it goes together with a goal about competition, around economic interest, about geopolitical powers, and where issues like secrecy, intellectual property monopolies are very central. That's a totally different framing than the one that I mentioned around public health. And if we see today that the European response in terms of preparedness for pandemics and in response towards it is HERA. It will be discussed much more later this week. I think it will be really important to see whether indeed it is a response framed as public health or as health security. And I think that reading the documents today, that is not all very clear. And I think it's maybe an illusion to think that we can do win-win. I think there are real choices to be made here in terms of what type of health response we are looking for. And then finally, I think that given what we have observed during the pandemic now that and the geopolitical dynamics nowadays, that we are going towards a much more regional type of multilateralism. It's maybe logic. I mean, there is no one size fits all to many of the problems that we're facing, but there is a realization that we are very much interconnected and that maybe more regional resilience and autonomy, but then in a way that is organized towards global perspectives and global objectives is the way to go. But then I think it's really important, if we go in that direction, that we do not act as if it is a level playing field. We know that today there is a high divergence and high inequities between regions, for instance, in their capacity for technological innovation, for instance, the manufacturing of the critical health technologies, etc. We know also that in terms of access to financing, there are much differences. So if we are altogether building a much more regionally decentralized multilateralism, I think we need to have the fairness then to actually empower the regions first with all the technologies and tools and knowledge and everything they require to build this pandemic preparedness and response capacity in the region, such that we can actually, in a multipolar world, all complement each other rather than be in competition as we have been so far. And so with that, again, leaving the old health politics behind, I think we need to foster a collective intelligence of knowledge and technology sharing towards global equitable access that can be organized in a much more regional way, but where after all, the basis is solidarity and justice and not aid or charity. Thank you very much.
For those reflections, I think you've raised a number of key issues that we will turn to our panel members to in just a moment to respond to. Before I do that, I would like to bring in our audience and invite you to already respond to our first polling question, which you can find on Slido. Again, it's app.slido.com. What I'd like you to do is to share with us what were your main takeaways from our spotlight speeches in just a couple of words. And what we'll be doing is trying to get from our audience members what were some of the big picture themes and messages that you took away. While we have our audience helping us to make sense of our discussions so far, what I'd like to do is now turn to our three panel members who will indeed be responding and reflecting. And we'll come back to the Slido in just a moment. But let me turn now to our three panel members, and I'll introduce each of them briefly. We have Hans Kluge, who's the Regional Director for the WHO Regional Office for Europe, Sandra Galina, Director General of the Directorate General Commission, and last but not least, Agnes Binagwaho, who is the Vice Chancellor of the University of Global Health Equity in Rwanda. I'm really delighted to invite all three of you back here. All three of you here, excuse me. What I'd like to do is I'll begin with Hans, and I'm going to ask you to respond to the spotlight speeches. We heard, I think, a few themes that I'd like to just foreground and put on the table. One is, of course, the need to be quite ambitious, as we heard from Dr. Tedros, in some ways in rebuilding and strengthening and rebuilding a global health architecture, and at the same time a long-running trend of weakness in the multilateral system that we heard from Elena Lazarou, who reminded us that the rise of unilateralism, the loss of trust, the gaps between everyday citizens and global governance institutions are trends that, of course, predated COVID, but we saw the effects of this certainly throughout this pandemic. And last but not least, some of the challenges that come up with both the rise of stronger regions, and I think for Dr. Kluge in particular, you are no stranger as the head of the regional office within indeed a global institution. Is there a tension, in your view, between the need for regions, for governments at national and regional level to protect the health of their own citizens, while also, of course, ensuring that it's not only their own citizens who, for example, will benefit from access to vaccines or other important interventions? So let me turn over to you for your reflections on the role of Europe in multilateralism today. Over.
Thank you so much. I mean, these are a number of really big points, and I enjoyed very much the spotlight speakers. So maybe as a first round, some thoughts. So first, my narrative has always been that international solidarity does not exclude national responsibility, because there has been so much told about equity and some front-runner countries in the COVID-19 vaccination. So politicians obviously are elected to take care of their people, but it should be with a global outlook. And I think that's very important, whether we speak about the equity in COVID-19 vaccines or additional jabs, etc. Number one. Number two, the key issue is indeed trust. trust is the political premise of the WHO European Programme of Work, which is based on what do the citizens legitimately expect from their health authorities. And that corresponds very well with the main recommendation of the Monti report. A year ago, I established the independent Pan-European Commission on Health and Sustainable Development, chaired by Professor Mario Monti, to rethink policy priorities in the light of pandemics. And a key recommendation is to heal the fractures in society. Because if we don't heal the fractures in society, then any new form of multilateralism will not be legitimate. And for this, we have to measure first, who is it that we are leaving behind? And very important there is that my mission to Brussels on Thursday morning, together with the European Commissioner, Ms. Telia Kyriakidis, and the Queen Mathilde, the Queen of all Belgians in Brussels, we will launch the Pan-European Coalition on Mental Health, because we have to take care of the mental health of the people, including the workforce, to appease, to pacify the people. The third point is, if we speak about multilateralism, it has to be truly inclusive. This was one of the comments made by the leadership in the Russian Federation on the Monti Commission, that they saw it's truly inclusive. If we speak about multilateralism, right? China, Russian Federation, UK, so we need everyone on board. But here I really would like to commend the European Union for its increased role in global governance and strong support to WHO, because as President Orr was mentioning the opening remarks, it's true that we had a tough time when the United States was going to withdraw. And at that moment, you know your friends, and the EU stepped forward, and we should not forget about this. Final point on WHO. As a regional director, for me, the diagnostic is crystal clear. What about our own institutional resilience? Are we fit for purpose? WHO needs to change in 3 directions. Number 1, more inter-regionalism. The institutional comparative advantage of WHO is that it has 6 semi-autonomous interlinked regions, and each of the region directors is exercising global and regional multilateralism on the daily basis, because we are political, technical, culturally proxy to the member states. Number 2, there needs to be more political participation by the member states under the international health regulations. If we do not tackle the elephant in the room, or we could say the phoenix in the room, which is what happens if signatories to the international health regulation, or be it a new pandemic treaty, more ambitious, does not include provisions for non-observance by signatories, then there has to be accountability, and this has to include free access for WHO missions to countries, including data. And third, there is a need for more sustainable and predictable financing of WHO. So maybe as a first round, I will leave it here. Thank you.
Thank you so much, Dr. Kluge, for sharing those thoughts with us. I'm sure we'll come back to some of those themes around accountability between countries. What I'd like to do is now turn to Sandra Galina from DG Santé. We heard a number of ideas being put forward by the previous speakers. We heard the joint procurement of vaccines by the European Union being described as a quantum leap, and that the EU has also been one of the champions of multilateralism, including in the establishment of the ACT Accelerator. On the other hand, we've also heard concerns raised that the EU has been opposed, for example, to the TRIPS waiver that many developing countries have asked for, and that by being so successful in procuring vaccines for Europe equally across the EU, at the same time, this left not enough vaccines for the rest of the world. What would you say to some of these critiques that have been raised about the role of the EU in the broader multilateral system? Over to you.
So thank you for inviting me, and I would like to say a big thank you to Clement Sauer, with whom we have been working on this procurement for the EU. Let me start with the last point. I think it's almost paradoxical that you say that, because in actual fact, Europe has been a platform for production of vaccines that have been largely exported also to other countries in the world. So let me say, of all the production, half of it went to exports. We were never dreaming to actually stop that. We may go into other areas of how Europe could have worked, I would say, internationally, but as regards the sharing of the production of vaccines, frankly, I think that you can see it very clearly that the numbers speak for themselves. I would like to say that we have been the largest supporter of COVAX from the very beginning. The president herself has stepped in to support COVAX, and we walked the talk in the sense that we not only have put there 3 billion, but out of those 3 billion euros, 1.3 come directly from the European budget. So we have supported this institution, and we believe that it is the right way to go. Now, let me say 700 million doses were exported around the world from Europe. This is not a small number, but let me say that if I were to transmit to you what I see as the experience, I would really like the European model that has granted the same portfolio, the same vaccines from Uppsala to Limassol. I would like it to be repeated on a world scale. For that, I think we need to have a system that ensures a rapid and equitable rollout of vaccines. I don't think we have it yet, but we definitely, as Europe, we are ready to go there and to do whatever it takes to make it a reality. We have committed to donating 500 million doses, and we will live up to that. But I was very much, I would say, supportive of the words of Els, who was saying we don't want charity. We should have a means for producing vaccines in the different areas of the world, and not have today countries that are still denied access to vaccines because simply there isn't a possibility to produce it there. So, as I say, a rollout is the first thing that I see. There is a second element, which is how to prevent, I would say, these emergencies, strengthening capacities. Internally, we have created HERA, but let me say at world scale, we need to have a better way of dealing with the age of pandemics, as it is often referred to. So we need to have to help build manufacturing capacities. As I said, we need to be having this objective. In terms of the waiver, we have been supportive there again, perhaps is my good knowledge of trade policy, but we have been supportive of compulsory licensing, which is, I would say, definitely the thing to do. So I'm not too clear why a waiver can be much better than a compulsory licensing, where all governments that are under pressure can resort to compulsory licensing for these products. By the way, the proposal was tabled in Geneva, so let's perhaps debunk this fallacy. And I would say that perhaps what we will need to do is also rethink the global health security architecture. So at the moment, may I say, multilateralism has not delivered. We need to face the criticism if we want to be fair. At the same time, we as European Union, we are strong supporters and believers in multilateralism. Our DNA is multilateral. There was a very good reference to the fact that multilateralism, is an element of improvement of the situation for all the participants in a multilateral stage. So let me say, we are definitely going to continue to support multilateralism, as I say, with actions, with words, with deeds. And here comes perhaps the idea of an agreement, a convention on, for pandemic preparedness and response. In short, now it is called Pandemic Treaty. we are ready to engage. And I must say that we need to have a multilateral anchor to the work that we do for health, because, this is a matter of fundamental rights, of human rights, So I'm very happy to see that people who have been representing patients for many years, like Yanis, are in this event, because it's about patients, it's about lives of people. It's not about, I would say, simple international law or national law. So for me, the experience internally in the EU can be shared. We are ready to share it. We are ready to participate and to create the dynamics that are needed to be better able to face multilaterally the challenges. And I must say that I share many of the words that were said by Els earlier. Multilateralism needs to be inclusive, needs to be adaptable, needs to be pliable to the new challenges. There isn't one multilateralism in a glass case. You have to put life into it. Thank you.
Thank you so much for those comments. And I think that indeed we'll be coming back to all three of our panelists in just a moment to follow up on some of the ideas, Ms. Galini, that you've put on the table. Let me turn now, however, to Vice Chancellor Agnes Bignaguajo to address some of the questions that really motivated this session, which is not only about looking, of course, within and across Europe, but also outside Europe. And a couple of the questions that have been put on the table regard whether Europe is a reliable, trustworthy partner for the Global South, if there's another region of the world where in some ways we saw a quantum leap in regional cooperation. This was among African Union member states, the AU, Africa CDC, WHO Africa Regional Office have all been very active in this pandemic, including but not limited to, of course, vaccine procurement. And yet still today, it is a region of the world where we only have about 1 to 2% vaccine coverage. So what is your perspective on the reliability of Europe as a regional partner, and particularly as this question of a pandemic treaty is coming up again and again, where indeed different parts of the world will need to all come to the table to try to agree on common rules. Over to you.
Thank you, first of all, for having me, all of you. It's an interesting debate. And let's take the angle of COVAX. I understand and I agree with what all the speakers so far have said. However, I totally disagree with what is on the ground, the reality. The support of COVAX didn't show, at least in this part of the world, that Europe walked the talk. Because after agreeing on COVAX, rich countries, and I put inside the European countries, went to pharmaceutical firms, and it's true that they have done a little vaccine and export a portion of it, but they have stored 2 to 3 times, and some countries 5 times what they need to vaccinate their population. While another part of the world, like you say, has between 2 and 3%. The low-income country have 2 to 3% people who are vaccinated. So they store those vaccines. They don't put in circulation. And the fact to say that countries are not ready to roll out vaccine is just an excuse. It is for us in this part of the world, selfishness and greed. So the other thing is, not the European people, but the politicians who cultivate nationalism to remain in power or to be elected and do and lie openly without any accountability. There is no reason, before talking about multilateralism and make it binding and accountable, it's true, it has to be equitable, it's true, it has to be. But the politicians who are signing should be accountable also to how they lie to their people. And the law support that has been highlighted in the beginning of this session is due to bad governance with lying, and people doesn't know where to go. And let me tell you, I disagree about the rise of the phoenix. You know why? Because the phoenix regenerates itself like it was. We want some changes, not the rise of the phoenix. I don't want to see a phoenix flying above our two continents. So, yes, there are some multilateralism that has worked well. And African Union come out of this crisis has grown in trust and in actions. And without that, and also without CDC Africa, we will not have a seat on the table, and we will have died more. Because don't forget that CDC Africa put all the Minister of Health together at the first case in Africa and say, we are going to follow science. Rich country doesn't always do it, but we are going to do that because we cannot afford to have such a number of people sick. Now, with all this, I have to say that Africa-Europe cooperation will need more accountability. Don't forget that we didn't forget that every year, even if we receive a lot of money coming from the rich countries, $41 billion are extracted from our continent to go elsewhere. And this keeps us poor. So we cannot focus on health only. If Africa had a share and fair trade with other countries, and sell their products for their value and transform their product before selling it, what is totally a fight against. I think we will have the money to have the healthcare system we need. And Europe should recognize that it's a story of 400 years of taking profit of Africa since the slavery, the colonial time. So we need now to build on equity and not pretending help Africa by giving a portion and extracting more from it. And also, we have also to discuss other things like the brain drain. You know that $2 billion were lost in 2017 only by taking people trained by Africa with African money for development and taking in Europe or in other rich countries at zero cost. So fair partnership, fair trade, fair sharing of the opportunities. Yes, I believe that partnership is possible, not like a race of phoenix. We need another bird, a new phoenix, not the same as 400 years, 300 years, 200 years, and last year. And also, we need that's not true that European Union has fight for Africa to be able to manufacture, change attitude in between, and that's good. But you have rich countries that doesn't want to share the know-how, and they can share by making money, not give. It's business, but by helping Africa to produce quickly, we will be more at least ready for the next pandemic and maybe for this one. But we cannot trust totally a part of the world that we soon 1 billion doses in stock and say there is a lack of vaccine to share with you. Thank you.
Thank you, Chancellor Binagwaho. I think indeed lots of material for all of the panelists to respond to. I'll turn to the full panel in just a moment. But first, what I'd like to do is to turn to the audience and ask that we have the word cloud from the Slido put up. Here we go. And these are the key ideas that all of you have been hearing from the speakers so far. We see, of course, solidarity is right there in the middle. There is hope, so definitely some more optimistic messages, but also indeed a number of, I would say, concerns or critiques also being expressed, such as lack of trust, pre-existing crisis, a need for trust, and certainly a need for new models and new thinking. I want to now delve a little bit deeper, and let's see from Floris, from our cartoonist, what he has been capturing from the conversation so far. Aha! Justice, not charity, and I think this is a dragon we see here, or is that a phoenix? My art skills are certainly not as good as Floris's. But definitely one of the big themes that we've just heard is a call for justice rather than charity, and multilateralism based on cooperation, not based on charity or relationships of extraction or colonization. Anything else, Floris, you'd like to share with us at this point? We'll come back to you. Okay. Now let me turn again to the audience via our newsroom. Yanis, what are you seeing on Twitter from our participants?
Thank you, Suri. A fascinating discussion so far. A lot of interesting interventions, and the discussion is going on also on Twitter, but also on Slido. We have a lot of questions coming in. There are a lot of questions around how do we reconcile health security with global health security for Europeans with global inequity. Is there a solution there? How do we tackle the mistrust towards institutions that actually strive for multilateralism? And there is a question there as well. Dr. Kluge referred to the need to hold accountable the signatories of multilateral agreements who do not respect the agreed principles. The question is there, how do we do that in practice? How do we achieve that in practice, especially when even EU member states do not seem to respect or to abide by their own commitments? And also questions around transparency and public accountability in times of COVID, and how those relate to making sure that we deal with the suspicion, the mistrust, the disinformation that is going around. So that's all for me so far. Back to you, Suri.
Thank you very much, Yanis. Indeed, a number of different themes being picked up by our audience and different participants. I'd like to come back now to our panel members and give you an opportunity to respond to both what you heard from our audience, what you heard from each other, and perhaps I'll begin with Ms. Galina. Can we get all of our panel members up on the screen? Here we go. Okay, excellent. Let me hear first from, and give the floor first to Ms. Galina. What do you say? Has Europe been a credible partner?
Because the audio was completely out. I only heard the final part, which concerned more Hans, so I'm not so sure I want to reply to his question. But I would like to say to Agnes that I fully support her desire to really be able to produce in Africa, and with my past, I think I am more than credible in that. We have launched the possibility to have production facilities both in different parts of Africa. Rwanda is one, there is Senegal, and there is South Africa. And I think that Africa is more than ready to be able to produce the vaccines that African citizens need. So definitely no charity and no return to the old normal, for God's sake. No, she's right, not rising to a phoenix that is the old one. By the way, the old normal does not exist anymore. So if there were other questions for myself, I would like to reply to them if you could repeat them, because the audio was inaudible, as one says.
Perhaps I could just ask one follow-up, which is on the theme of technology sharing. So you emphasized the support for local production in sub-Saharan Africa,
Yeah, and
and what about
if I
technology
may
sharing?
say, yeah, with compulsory licensing, we can have good production and not wait for charity, as Agnes was saying. That's not what we want to do. So, in my view, technology and the means to have that technology transfer are there. So, there was this. We should all be very lucid when proposals are made. And I think we have been very concrete in the steps for production, so capacity, and capacity can be built. And you give that technology that allows people to produce those vaccines. And I think there is at least one company that has made it very clear that it's very supportive of what we're doing, which is BioNTech. And so we are ready for the challenge. And this is in the public domain. So I would really commend that. And I would say, yes, it has not necessarily delivered, but it's not for that we should walk away from multilateralism. I still think that we need to help COVAX that had a very difficult start, I must say. It was perhaps difficulties were not anticipated in the difficulties of this scale. But we fully support COVAX, not just with the money, but we will be donating doses through COVAX. We are organizing our act, and I must say that I do believe in what Agnes was saying, that one should not be selfish and hoard the vaccine. That is not a good recipe for anyone.
Thank you. Let me turn now to Dr. Kluge. One of the key points you made earlier was around accountability between governments, and also governments opening themselves up to scrutiny from WHO. But as Yanis raised from the floor, one of the big questions is how. And what do you think is essential for that how?
I think that's the big question, really, and it's ultimately, decision by the member states. I always say the World Health Organization is not the World Health Inspectorate. We are as strong as the teeth giving by our member states. In general, I am a person of dialogue, especially in these times of geopolitical tension and people feel very, very pressured. So I strongly believe in collaboration, cooperation, rather than putting, whether it's states or industry, before moratoriums and accomplished facts. Of course, there are a number of mechanisms which are there, like the Nuclear Proliferation Treaty and other treaties, where there is a mechanism to allow experts from outside to come to the country and do a verification. It links a bit to one of the recommendations of the Monti report, which is on improved health governance at the global level. One of the recommendations is indeed for a pandemic treaty to encourage governments to pool some sovereign decision-making for policy-making areas. From my own experience, I remember when I was working for 5 years as a medical officer for tuberculosis, HIV, and malaria in the Union of Myanmar, when there was in 2004 the cyclone Nargis. And there, the body which really was assisting the country and had access was the ASEAN. So it comes back a little bit to one of my previous points on the influence and potential of regional organizations which are trusted and proxy to the countries, historically, culturally, politically, and linguistically. But definitely this will be a very important consideration. Maybe a point for Agnes that indeed, very important point that Agnes made. I did invite 2 weeks ago the WHO Regional Director of the African Union, Dr. Moeti Chiri, to Overreaching Committee, which is our annual governing body board. So Moeti had the opportunity indeed to speak to the EU, to all the pan-European 53 countries, also on the equity in vaccines, because that's something that definitely we strongly believe in, that here in the pan-European region we always have a global outlook, and there are also many things from us to learn from the African region, not at least the strong sense of community. I think that's something very key here to strengthen the pan-European region, because all pandemic fights start and finish by and with the communities. Thank you.
Thank you. Let me turn back to Chancellor Binaguaho. What's your reaction both to what you've heard from your fellow panelists as well as from the floor?
So as I said before, 100% acceptance and agree. Me, I'm watching the facts, and the facts are not always there. And for WHO, for example, Africa is Afro doesn't represent Africa, and adding other multilateral organization is just swallow the money that doesn't go to treat and prevent disease in community at community level. We are so many in Africa, and our WHO was supposed to do that, to align WHO in Africa to the Council of Ministers of African Union. There are two. We are spending money in both. They're spending time in both. And WHO Afro has no political power, or even they can advise. But what the government are listened to, it is the Minister of Health Council at African Union. So this is something that WHO could think and stop fighting, because there is a fight not for this to happen. And it will be saving money and reinforcing the way we listen to the expertise of WHO, because now, let me tell you, we turn to CDC Africa because they represent an union more than to WHO Africa, because it doesn't represent Africa. All the north of Africa is not in, big part of Africa. So now for the what is said about the support, etc., time will tell. So far, I told you, I have been very disappointed in what was signed and what is the outcome of that. And we have to make sure that giving WHO, which is not always in favor of Africa, we may have a WHO director that is an African, doesn't mean they are in favor. Because I just think about the past, WHO have to change, but the past, the double standard of drug regimen, etc., knowing that they are not working, the scandal of Tamiflu that has never been dig off, WHO has to clean his house and change his essence as multilateral organization to fit the time and the transparency need today. And African, I don't believe that I want to bury multilateralism. I don't know. But multilateralism exists since history exists. It has taken shape in Europe the first time in a big way when they start to come together to fight Napoleon. It was multilateralism for fighting and conquer. Now create a multilateralism for public good, for saving people who are very far from where the people are working. It's something else that we need to work on. And again, without accountability, don't dream about it. Without equity, don't dream about it. A low-income country will just say yes and sign just because they're obliged, not because they believe they will get the same right inside that treaty. So we need to revisit the world as it is, not only in health.
Thank you very much. I want to give our two spotlight speakers just a very, very brief moment to comment on whether they've heard satisfactory answers to the questions they raised. Let me first turn to Elena Lazaro in less than 1 minute, please.
Yes, thank you. Well, I've learned a lot, that's for sure. Perhaps just to say one thing to me that that should be mentioned in the context of everything was said is that when we look at the EU as an actor in multilateralism, it's always perceived that where the EU has most competence, it is more powerful in multilateral negotiations and international cooperation. And it's important to remember that until this pandemic struck, the competence of the EU in health policy was much less than what we're looking at now with HERA and the health union, as Mrs. Galina said. So I think it's beyond expectation what's happened, and we have to look forward now how much the EU can do globally in health. Just a word on accountability, perhaps. I mean, this is a huge issue, not only now, but also with development aid and other forms of EU financial support. If I would say, of course, that the tools for accountability of financing of third countries are continuously being refined. The Team Europe approach, I think, has integrated more oversight on the implementation of financing, and that's also a pandemic response mechanism. But of course, looking forward, I think, and that's most important, that, you know, not only multilaterally, but in bilateral high-level dialogues with regions and countries in the developing world, this issue is something very important for the future. Yes. Well, okay. I was thanking everyone for what I learned through this conversation, and I was also saying it's important to note that that the EU in multilateral, its power to act as an actor in multilateralism is commensurate in many ways to its competence internally in the policy field in question. So it's important to remember that everything we're talking about for EU is coming from a place where the EU health competence was not actually quite high. It was mostly with the member states. So now we're moving with HERA and the European Health Union to a time where arguably the EU will have more influence globally to act as an actor, as a one voice in global health issues. So that's one. The second I was saying was about accountability. That it's a huge question, very important, not only here but also any kind of development aid and external financing by the EU to third countries, and it has been highlighted several times by all sorts of auditing exams. And it is in the process, the EU is continuously in the process of integrating more accountability mechanisms, but also on the global level at the OECD DAC. I think this is a big discussion. Obviously, if mechanisms for oversight and accountability of how things are implemented don't exist, then no policy will succeed in that sense, in cooperation, international partnerships and cooperation. And to that point, I was saying that the Team Europe approach that was developed during the pandemic has integrated quite succinct mechanisms to sort of link financing to implementation. But obviously there remains a lot to be done, including with diplomacy in dialogues with regional organizations and states, and I would even say cities, which I don't know Africa, but in South America that I know, some state government, local government has been critical in deploying vaccination, but also being engaged in the fight against the pandemic, directly linking with WHO and the EU. So thank you very, very much for this opportunity. I'm sorry about the connection problem. I don't know if it was just mine or general. So sorry, but thank you very much.
I think we all got frozen actually, and because we had a snafu, let me go very briefly to Els before handing the floor to Ilona to close our session. Els, a quick reaction from you. Okay, I'm not sure if
on which people have not reacted. Are you hearing me?
Yes.
Okay. Yeah, so I just wanted to say a few words about the concept of common goods and the sharing of knowledge and technologies that really have not been adequately addressed. I'm happy to note that the European Commission is now favorable to compulsory licensing. That has often been very different in the past, but I don't think that that is the response to what we need today. We have a very complex technology with a lot of knowledge, know-how that needs to be shared not just to be able to produce in Africa under license of J&J or Pfizer, such that the control over who gets access to these vaccines remains under corporate control, but actually real sharing such that African countries, producers, public or private, but can produce for their own. And I think that that is not going to happen through compulsory licensing. I think we need a totally different view to see these technologies, these critical technologies for pandemic preparedness and response as global common goods, such that everybody, wherever needed, can be able to produce and allowed to produce. And compulsory license is not a solution to that. That is very clear. So I'll leave it there, knowing that we don't have much time. Thank you.
Thanks, Els. Many issues opened up that I think the rest of the forum will address in the coming sessions and days. I just wanted to flag 3 themes that I heard highlighted over and over again: the question of accountability between different countries and regions, an ongoing crisis of trust, not only between citizens and institutions, but between countries and regions, leading to a very fragmented overall global system, and indeed an open question: can multilateralism be reinvented? There are a few people better than Ilona Kickbush to help us think through some of these questions. She will help us to pull out some of the big overarching themes and take us across the finish line. Ilona, over to you.
Hello, Sari. Wonderful to see you here from Gastein over there in Geneva. And I'm very happy to cooperate on this issue. I think we heard that COVID brought the weaknesses of the multilateral system to the fore through global health issues. It showed that this system does not produce equal benefits and that is not inclusive. It showed in particular that it does not reflect geopolitical realities. It's the end of hegemony in global health. We're in a multipolar world, and different countries have very different viewpoints as to how global health should be approached. Multilateralism in health is not ready to face cross-border needs and does not produce global public goods. It must clearly move out of a siloed approach, and it has kept multilateral organizations weak and underfinanced, and countries have not fulfilled their obligations. And just in general, as Agnes has highlighted, and as many of the young voices in global health underline, it must move out of a model that they describe as the need for decolonization of global health. And these power relationships are something that we must look at much more closely. We heard that the new model, I don't dare say the phoenix anymore, must be built on solidarity, justice, and human rights, and that there is no old normal we want to get back to. That has gone. And definitely geopolitics has shown us that very clearly. And that means we can no longer work with a global health model that is built on charity and that is built on the kinds of multi-stakeholder models that are partly privatizing that we have experienced over the last 10, 20 years. This implies, and we heard it first from Clement, but also from others, that the new social contract must move in a direction of this greater equity and that the development model of global health is over. We must reinvent global health to be one that truly approaches global public goods. We have heard and we experience that vaccine equity will define future global health and the multilateral system. It will define who countries trust and how they work together. And we heard a very clear plea that the EU must work hard to establish this trust globally and to build fair partnerships that underline equity. And that the starting point for that is not only global health policies or global health security strategies, but very much lies in other policies, policies such as trade, as agriculture, policies that relate to workforce and brain drain, policies that relate to the environment and the Green Deal. That is why, if we want the EU to play a much stronger role in global health, there are 6 points that the EU must pick up. First of all, the health competence of the EU must be increased, and that must include global health competence. Second, it must take responsibility and push forward on establishing vaccine equity. It must be active in norm setting, and the discussions around a treaty for a multilateral anchor are absolutely critical. It must spearhead new models that support global public goods, their sharing, their financing, and this in particular includes science and technology. And it must act against fragmentation and decoupling of global health. Finally, and we heard this again and again, it must support accountability and transparency, and those two also are a key component of human rights, because no one is safe until everyone is safe, but that is not only in health terms, that is the right we have as citizens. And therefore, the European Union must develop a new notion of global citizenship in health. Thank you very much.
Professor Kickbush, I think that ends our plenary session. I want to thank all of our speakers and panelists, and if we have time to flash up a cartoon, I know that we have 4 from Flores who's been sketching very, very quickly. Last but not least, we have a evaluation question on the Slido, and we invite your reactions and your comments on this session, which I think has opened many, many channels for further discussions in the sessions and days to come. And with that, signing off from Geneva.